Your media, where you are.
Hello and welcome to the Healthfix with me, your boy Mo, for another exciting episode. And today we're speaking about intravenous therapy or IV therapy. I mean, as it's known, it's a very popular method of, how do you explain it? Method of what? It's
Administration of medication.
yeah. What I do know that it's very trendy these days. I see a lot of it on the socials. I see a lot of people going for IV therapy, IV therapy medication these days. And today I've got a specialist who's going to tell us more about what it entails, the benefits of it. Does it have any side effects? Darren, how you doing, bro?
I'm very good. How about you?
Thank you for joining me. Thank you for
It's on the pleasure.
honoring the invite, man. So take us through this. What is IV therapy?
Well, IV therapy, as you had said earlier on, is intravenous therapy, essentially. So it is administration of infusions directly into the venous system. Yeah, so it has been around for ages, and at some point in time, everyone has had one. But then the most common thing now that is happening is nutritional IV therapy, which is nutritional IV supplementation. And that's the trend that is essentially going on now.
Okay, so somebody decided a long time ago that they're gonna put. So it's a drip.
It is a drip.
Yeah.
In simple plain terms, it is a drip.
Okay. So when did this start? The whole practice of intravenous therapy, before we get into the whole nitty-gritties of it.
If we're gonna do background, like late 1800s, that was the first time recorded IV therapy. It was used to administer medication directly to those patients that couldn't actually consume or take in anything orally. That was the first time it was ever recorded. It's been there since, but obviously used in medical holistic setting. And then early 2000s, that's when we actually started using it for nutritional supplementation mostly. It's always been there, but early 2000s was when it was now mostly used for nutritional supplementation outside of just medicinal purposes. And which is what we now know now as IV therapy, but in essence, that is now nutritional IV supplementation.
So when we speak about nutritional, we often think about something that we consume via your mouth, right? Essentially. So what are the benefits of having something that you consume through your veins?
Well, IV therapy, the biggest benefit is 100% absorption rate.
Okay.
Because anything you eat orally, it has to go through processes of digestion, absorption, reabsorption, all those other processes. So you never ever fully get 100% of what you're consuming. Yeah. So IV therapy bypasses all those aspects for 100% delivery. So whatever you're giving, surefire, you're getting. Yeah.
So take me through the different types of IV. I know there's a whole, because I saw the list. Like there's a menu of IV therapies that you can go through. So take me through some of the most popular ones that you give.
Well, IV therapy in essence is supposed to be individual based. It's not supposed to be like a blanket therapy per se.
Okay.
Because each individual is different. There is the basic monomers that people need, which is what is being advocated for the most part, but it is individual based and should be based on individual needs, and individual's profile based on whatever conditions you have, lifestyle that you're living, and so forth, because all those things factor in when it comes to the choice of what we actually give you. Yeah, but in terms of list, there's countless. Like there is countless because like you said, it's the latest in thing now. Multiple IV bars, and each one has got its own formulation of whatever it is that they want to give you. And for the most part, they should let you know exactly what is in there. But pretty much is the same thing. So your vitamins, your antioxidants, your detoxifiers in different concentrations and everything. Being delivered for whatever purpose you want it to be, whether it is like just to aid build up your immunity in some way using the building blocks, just for that energy boost if you're feeling run down, if you're feeling hungover, just to
I would need that a lot.
just to reverse the effects of alcohol.
Yeah.
The ladies love the the skin things.
Yeah,
that
I would imagine they would.
that
Yeah,
rejuvenate cellular
yeah.
regeneration and all those other things to give them a better skin appearance.
Mm.
So the list is essentially limited by whoever is administering. So that's why I'm like, it's usually individual based on what you can receive and what you're trying to get out of it.
You mentioned in that statement that there are a lot of IV bars popping up, right? Can anyone open up an IV bar? Because I know you're a qualified doctor, and I would feel safe if you were the one administering it to me.
Yeah.
Can anyone administer IV treatment?
Technically, no.
Okay.
Because it has to be opened by a licensed medical professional.
Okay.
Because it is a form of medicinal therapy. Yeah, not anyone can just come up and put up an IV line on you. You know, it is a bit sketch now simply because multiple of IV bars are not actually or don't actually have doctors and everything like that. Those are the ones that offer you just a blanket statement or don't even tell you what it is that you're supposed to get or experience. Ask them to break it down for you. Most people fail, but technically not everyone should open it, and every IV bar should have a licensed medical professional.
So just to build up on that, what could go wrong if it's not administered right?
Well, for the most part, there isn't many side effects because it is essentially administration of what your body normally gets, what you normally get through eating and all those other things. But obviously, with anything that you're putting into a vein, it's directly invading the body, if you can put it that way. So obviously, there's local side effects in terms of you miss the vein altogether and actually administer into tissue. You can introduce infection if it's not actually done in a aseptic procedure. But then in terms of systemic, really, you can get an allergy because ultimately people are people, you know, so you can get the mild allergic reaction. It can happen, highly unlikely, but most of the time the side effects you get are mostly local based. Yeah.
All right. So now I'm going to talk, is there beef now? Because there's supplementation that you consume orally, which was trending for a long time.
Yeah.
And now this seems to be overtaking it in terms of...
I think there shouldn't be beef, essentially.
Yeah.
I think they work hand in hand, you know.
Is it?
Like, yeah, like it's now you fighting 93 petrol and 95. Like, do you get what I'm saying?
Okay, yeah.
One just does it better than the other.
Yeah.
Do you know what I mean? Not that one is less than the other per se. Because, like I said, the biggest advantage is you bypassing the body, essentially, to give whatever it is that you're giving. But ultimately, end result is the same. One just takes longer. Yeah. But then if you're already on supplementation and you're religious with your supplementation, you really actually need IV.
Are there people who can't take IV therapy?
Yes.
Yeah.
Like I said, supposed to be administered by a medical professional and is individual based. So depending on your condition, you cannot get some things, you know. If you've got heart disease, you cannot really get lots of fluids or stimulants through an IV that would actually aggravate the heart and so forth. If your high blood pressure is way too high, you know, and it's poorly controlled, we are putting fluid into the blood system, which essentially increases blood pressure. So it is dependent on the patient's chronic conditions, medications that they're on as well. And obviously you have to be aware of the effects of what you're giving to the body so that you can mitigate adverse effects. Yeah.
So I think what we're getting out of this mostly is that when you do get into an IV pause, that you check if there's a medical practitioner.
Essentially, because anything can happen.
Yeah.
Anything can happen. Honestly, it's worst case scenario, touch wood, but
Yeah.
most of the time nothing happens. But just in case something does happen,
Yeah.
you can get adequate help and nothing drastic comes out of it.
Yeah.
Yeah.
So how does it help in terms, because I'm very big into training. So how does it help in terms of recovery? This is a very selfish question.
No, it's fair.
What would I have to take for quicker recovery?
There is drips that are formulated for highly active individuals, you know, and it's got elements and things that don't actually or are not necessary in a drip that someone who just wants energy is going to get. You know, it's got your BCAAs, you know, that would be there. increased levels of Maxal, things that will help you recover quicker. And also fluid volume is also increased because you use up lots of fluid itself, So it is formulated in a particular way that it gives you most of the things you need. Also based on supplementation, because usually active people are on some form of supplementation to help with muscle recovery, muscle health, joint health, all those things. It's just bypassing that and putting it into an IV, which you get once a week. Yeah.
That's good news. So now I'm hoping to hear good news again, because I wanted to talk about money. So from a price point perspective, right? How much does a regular IV therapy treatment cost?
Because there's so
Or the
many.
cheapest one?
There's so many, so it's very hard to have a regular. Because there is very poor price limitations when it comes to that.
Okay.
So anyone can literally just pop into the market and throw away like whatever price they want to put across their drips and everything. But it's really not expensive because most of the time you're now paying for location where you're getting
for rent.
exactly the setup of the place, the ambience, you're paying for all those things. But then $1,000. $1,000 is a very good ballpark where you pay $1,000, you move it all the way up to like $1,500.
Is it?
Yeah, but
so that's $1,000 a month, $1,000 a week, $1,000 a day.
Most of them you can get them weekly, but then also it also depends on individual deficits.
Okay.
Do you know what I mean? So if it's someone who's high on supplements, like you take your oral supplements and things like that, they don't need them as frequently as someone who doesn't, because the body does have those monomers to some degree, though minimal. It's not running on empty. So someone who's running on empty needs it way more. But then frequency can be weekly, monthly, all dependent.
Tell you what, I might just jog everywhere and take my take my IV drip, because the prices of petrol these days are just ridiculous.
It would work out cheaper. It would work out cheaper.
So do you take any treatments?
Well, I'll take everything that I offer my patients because I need to know what goes on.
Yeah, okay.
So whatever you get from me, I've taken it in one form or another.
Is it?
Yeah.
That's a lot of injections, man. That's a lot of needles.
Yeah, well, someone has to test the poison.
Yeah. So who would you say your biggest consumers of the IV treatment are?
Oh, well, I think it's mostly on the youth, if I can put it that way, because of the trend, number one. And number two, only now are we more big on actually taking care of ourselves and investing in our bodies and all those things. So actually now take time out and take care of ourselves. So mostly the younger generation, your under 40s. It does happen, with anyone can come really, but mostly it's your under 40s and everything. Yeah.
So improved quality of life, obviously.
Well, you feel great. So obviously, if you feel great, I would like to believe it's an improved quality of life.
Okay.
Yeah.
So you're guaranteed to feel great after a treatment.
Well, with mine, yes. With mine, most definitely.
Yeah, you should plug yours in after we're done with this show. Tell them where yours.
Most definitely. If you don't, I know it's free. If you don't, it's free.
Yeah.
Yeah.
Okay. Cool. So what have been the reactions to yours now? Where you based in Rosebank, right?
Yeah.
So I can imagine you must have busy days, because Rosebank is like the hub.
Well, the thing is, like, we're still relatively young.
Yeah.
So we are busy enough. It's just that it's a matter of getting us out there to know that there is actually a medical practice that offers IV bars. It's not just those IV facilities that you don't know, or you find it straight bang in the middle of a mall. We are a fully fledged medical facility with doctors 24/7 there around the clock, qualified professionals, nurses. So yeah, we're in Rosebank. We're trying to get out there so that people actually come through and get up to standard care, Yeah.
I'm definitely gonna come check you out and have one of your treatments.
Yeah, most definitely. Come
see how it feels. Feel amazing, then I'll recommend it to
then
to
you
the
come and tell
people.
them that no. It works. It works.
All right, no, but tell the people where they can find you, bro, and your socials if you want to.
No, well, we are there on the socials. So, like you said, we're in Rosebank.
Yeah.
You find us on 5 Killenhove Road. It's called Epion Health Villages.
Okay.
Yeah, so it's in Rosebank. On the socials, it's Epion.
Okay.
You can find it on Epion. On my own socials, business-wise, you can find it. It's called Envisionment Lifestyle.
Okay.
So it's got a whole wide array of IVs that you can actually get, and we also do medical aesthetics. So you can also hop onto that, and yeah.
Darren, thank you for coming through, bro.
It's my
This has
pleasure.
been an interesting interview. And I mean, if you've got any questions, you can just pop them through on our socials, your_media_SA. If you've got questions for Darren, that we can ask him, and then he can answer us, and then we can pop them answers right back to you. But that is it for this week's episode of the Health Fix. Catch us again next week for another exciting episode. This is your boy Mo on the Health Fix. Second half, do it.